Did you know that the primary cause of disability globally is stroke? It's a quiet killer that may get you when you least expect it. Imagine this. You're living your life as you normally would. The sun is shining, birds are chirping, and everything appears normal as you awaken one morning. But then, imagine being afraid and paralyzed on one side of your body when you wake up one day. For thousands of individuals, it is the sobering reality of stroke. The important thing to remember is that it doesn't have to be this way. You can alter the direction of your life if you can spot the red flags and act quickly before it's too late. In today's video, we'll delve into the realm of stroke, unravel its mysteries, and give you the information you need to save your family and yourself. We'll talk about the 6 symptoms that might emerge up to a month before a stroke occurs. You see, by being aware of these symptoms, you're not only proactively improving your health, but also raising awareness in your neighborhood. We can change things if we work together because knowledge is power. Let's start with the fundamentals before delving into the warning signals. What is a stroke exactly? When the blood supply to the brain is suddenly cut off, a stroke develops. This interruption can be caused by a blood clot obstructing a blood artery, known as an ischemic stroke, or by a blood vessel rupturing and leaking blood into the brain, known as a hemorrhagic stroke. Here's the crucial part. The brain begins to deteriorate when it is deprived of oxygen and nutrients as a result of this disruption. Imagine if the brain serves as the body's command center and is in charge of all bodily functions, including thinking, moving, and feeling. A wide range of physical and cognitive disorders can result from injury to it. Now that you are aware of what a stroke is, let's examine its 2 main subtypes, ischemic and hemorrhagic. The first category is ischemic strokes. These make up roughly 87% of all strokes, making them the most prevalent form. When a blood clot or plaque accumulation obstructs a blood artery, the blood supply to a portion of the brain is cut off, resulting in an ischemic stroke. Hemorrhagic strokes are another issue. These are more severe but less frequent. They take place when a blood vessel in the brain bursts or leaks, resulting in brain hemorrhage. These strokes might have quite varied effects. Ischemic strokes frequently result in more localized damage to the area that the blocked artery supplies. However, hemorrhagic strokes can also result in increased pressure inside the skull as a result of the collecting of blood, which can also result in damage. Depending on variables including the location and extent of the afflicted region, both types of strokes can have significant and long-lasting effects. It's essential to comprehend these differences since they influence how strokes are managed and treated. 1. Sudden weakness or numbness. As you go about your day, you suddenly become aware that one side of your face is strangely numb. It's as though you recently visited the dentist and the anesthetic is still in effect. It could also be your arm, which finds it difficult to raise or grasp onto objects because it feels abnormally heavy and unresponsive. Your leg may occasionally unexpectedly refuse to comply, resulting in an uneven walk or even a startling fall. The important thing is that these numbness or weakness sensations often don't happen symmetrically. They frequently just affect one side of your body. This singular symptom is a major warning indication. It indicates that there may be a problem with the blood flow to a certain region of your brain. Even while it's simple to wave off such discomfort as a passing inconvenience, keep in mind that it might be your body's way of warning you of an impending stroke. Strokes frequently happen when blood clots or a burst blood artery prevent oxygen-rich blood from reaching certain areas of the brain, damaging nerve cells. 2. Confusion or trouble speaking. Think about a discussion you're having when all of a sudden your words start to become mixed up. You have trouble speaking clearly, and it seems like you've had a few too many drinks from the way your speech is slurred. Or perhaps you're hearing someone speak, but you can't understand a word they're saying. They speak in fragmented phrases and exhibit signs of disorientation. These startling communication or understanding barriers are frequently followed by irritation and fear. It's important to realize that certain speech problems cannot always be present. They might change in frequency and intensity. They can occasionally be so little that you would brush them off as an occasional slip-up. But here's the thing. These ostensibly insignificant disturbances can also be the first indications of a stroke. These communication problems can be brought on by strokes that impair your brain's language centers. Additionally, time is important. just as with other cautionary indicators. 3. Vision problems. The areas of your brain responsible for processing visual information, as well as the blood arteries supplying your eyes, can both be impacted by strokes. Blurred vision, partial vision loss, or even total blindness can occur when these regions are damaged. Any unexpected changes in eyesight for you or someone you know are a clear signal that something may be amiss. In such instances, time is of the essence. 4. Severe headache. As you go about your day, an intense headache that feels like a thunderclap within your skull suddenly strikes you. This headache is not like the one you have every day. Something far more harsh, severe, and sudden has happened. It could strike out of the blue and feel like the worst headache you've ever experienced. It's important to realize that this bad headache could not be like others you've had in the past. It's frequently called a headache unlike any other. A strong headache may be an indication of a hemorrhagic stroke or another issue with the blood vessels in your brain. Hemorrhage into the brain from strokes can result in severe headaches as blood builds up in the damaged area. 5. Dizziness or loss of balance. Let's now discuss the sixth and most important warning signs: dizziness, loss of balance, or trouble walking. Imagine yourself standing or moving about when all of a sudden the world begins to spin. You get the impression that the earth is shaky under your feet, or possibly maintaining your equilibrium is quite difficult for you. You feel as though every step is an uphill struggle, and you frequently falter or fall. These unsettling feelings of dizziness, loss of balance, or trouble walking may come on quickly and without warning. It's important to know that these symptoms are unusual and shouldn't be cleared off as a minor annoyance. The parts of your brain responsible for balance and coordination might be impacted by strokes. These uncomfortable sensations may occur if these areas are impaired. Your ability to walk or maintain balance may occasionally be affected by a clot or bleeding in the brain as a result of these symptoms. 6. Trouble walking. Think about attempting to move ahead, but your legs don't appear to be listening to you. Your motions become unsteady and disorganized, or perhaps you get severe dizziness and feel as though the world is whirling around you. You struggle to go forward and feel quite unsteady at all times. These problems with balance, which are frequently accompanied by a lack of coordination, can be scary and crippling. It's important to know that these symptoms are unusual and shouldn't be dismissed as normal clumsiness. Your coordination and balance may be impacted by strokes because they interfere with your brain's capacity to communicate properly with your muscles. A clot or hemorrhage in the brain that affects your motor abilities may occasionally cause difficulty walking. To avoid additional issues and increase the likelihood of recovery, it might be crucial to recognize these signs and take quick action. Let's now discuss 3 factors that can have a big impact on stroke risk. 1. Age and gender. It's a frequent misconception that strokes mostly afflict elderly people. Although age is a risk factor for strokes, they can happen at any age. Younger individuals and even teens are experiencing an alarming increase in stroke cases. This serves as a warning that nobody is completely protected. When it comes to gender, men and women have a significantly different chance of having a stroke. In the past, males were thought to be more vulnerable. Recent research has revealed that both sexes are susceptible to strokes and that women may be particularly at risk due to things like menopause and hormonal changes after pregnancy. It is vital to recognize that while age and gender might affect stroke risk, strokes are a disease that affects everyone equally. They may occur to anybody at any time. The most important lesson to learn from this is that everyone, regardless of age or gender, has to be aware of strokes. High blood pressure. Let's now discuss high blood pressure, a silent foe that frequently prowls within us. Hypertension, or high blood pressure, is a significant risk factor for strokes. Your arteries are like a ticking time bomb. Here is why it's important. The tiny blood arteries in your brain might get damaged over time if your blood pressure is constantly raised. Both ischemic and hemorrhagic strokes are more likely due to the injured arteries' increased susceptibility to blockages and ruptures. Consider this. According to the American Stroke Association, nearly 77% of people who have their first stroke and 69% of people who have a recurrent stroke have high blood pressure. These figures demonstrate the clear connection between high blood pressure and strokes. We cannot afford to ignore the relationship. The good news is that hypertension can be controlled. It can be controlled with regular checkups, lifestyle modifications, and medicines if required. In addition to lowering your risk of stroke, managing your blood pressure also protects your general health. 3. Smoking and alcohol consumption. Let's now discuss 2 lifestyle choices that might dramatically increase your risk of stroke: smoking and binge drinking. Let's start with smoking. In terms of your health, smoking has 2 drawbacks. It not only hurts your lungs, but it also seriously endangers your cardiovascular system. Smoking can cause your blood arteries to constrict, which makes it more difficult for blood to circulate. Your risk of blood clots, which can cause strokes, rises as a result. Think about this depressing statistic. Smokers are twice as likely to suffer an ischemic stroke than non-smokers. In addition, all tobacco products contain hazards. It's not only about cigarettes. Still, there is hope. One of the finest things you can do for your health and to reduce your risk of stroke is to stop smoking. Let's now discuss booze. Drinking too much alcohol might increase your risk of stroke, even if moderate alcohol use may have some cardiovascular advantages. Alcohol use can result in disorders including high blood pressure, irregular heartbeats, and even alcoholic cardiomyopathy, which all raise the risk of stroke. Heavy drinkers are more likely to get both ischemic and hemorrhagic strokes, according to research. Moderation is the key takeaway from this. If you do consume alcohol, do so sparingly. And if you smoke, think about giving it up. Your health and risk of having a stroke may be significantly affected by these changes. 4. Other risk factors. Beyond age, gender, high blood pressure, smoking, and alcohol use, there are more risk factors for stroke. We also need to take other aspects into account. Consider the disease of diabetes. It is a medical disorder that has an impact on how your body uses sugar and is a major risk factor for strokes. Your blood arteries may get clogged with fatty deposits from diabetes, making them narrower and more prone to clots. According to studies, persons with diabetes are up to 4 times more likely than people without the illness to get a stroke. Therefore, it's crucial to carefully control your blood sugar levels if you have diabetes or are at risk for developing it. Let's go on to discuss family history. Your risk may increase if someone in your family has had a stroke. Although your family history cannot be changed, you may use it as inspiration to take an active role in your health. The last issue is obesity. Being overweight can put stress on your cardiovascular system and increase your chance of developing diabetes, high blood pressure, and other stroke-related conditions. According to studies, obesity raises the risk of stroke, particularly in younger people. The good news is that many of these risk factors may be reduced by making lifestyle adjustments. Your risk of stroke can be considerably decreased by eating a balanced diet, keeping a healthy weight, being physically active, and controlling chronic illnesses like diabetes. Now that we've covered these 6 essential stroke warning symptoms, it's necessary to emphasize once more how critical early diagnosis is for saving lives. Keep in mind that time becomes your most important asset after a stroke. The more damage that can be done to your brain, the longer it takes to recognize the symptoms and seek medical attention. A wonderful fact is that it can save a person's life to recognize these warning symptoms even a month before a stroke occurs. You're enabling yourself or members of your family to obtain potentially life-saving therapies by recognizing these early warning signs. Early intervention, according to studies, can result in considerably better outcomes, including decreased impairment, a speedier recovery, and a greater quality of life. Therefore, let's not undervalue the influence of consciousness. Your newfound understanding might radically alter the situation. Always keep in mind that strokes are universal. Anyone, at any age, can experience them. Recognizing these warning signs early could be the lifeline you need. Thank you for watching. If you found this video informative and valuable, please consider subscribing to our channel and giving this video a thumbs up. By doing so, you not only stay updated with crucial health information, but also help us reach more people with this vital message. Feel free to leave your thoughts, questions, or suggestions in the comments section below.